Thank you, and thanks for having me today. It's really very, very exciting to be here. So I guess we start with our polling question. So the question is, how many active cancer patients are on Flatiron Health's Oncology Cloud platform? So I think everyone enters that on and polling is closed. So we have the majority are C and D. Am I supposed to answer that question now? What the right answer is, or it'll come out in my talk. So great, thanks. So what's that?
There was a check mark on that.
Oh, there was. Sorry. We'll see if I got it right. So just to give you a little bit of background about myself, I'm a medical oncologist. I'm a community oncologist. I practiced in West Palm Beach, Florida for about 15 years. And I joined Flatiron Health in New York about a year and a half ago now, and I actually still see patients 1 day a week, most weeks in South Florida, and then spend the rest of my time in New York. And what I wanted to talk to you about in this session is to really focus on the use of big data and how we at Flatiron and others are using this to try to solve a number of problems, but specifically to focus on two issues today. And the first is the fact that, as I think everyone here knows, the majority of adult cancer patients never get onto clinical trials. So this is a number you've heard before, 4% or 3%, depending on who you ask, of adult cancer patients in this country enroll on clinical trials. And that's important because, one, clinical trials are a good thing. They're often good for patients. They're how we advance treatments. They're how we make discoveries. It's also important because what that means is that 96% of patients don't go on clinical trials. And for those patients, we actually lose an enormous amount of information. And the way I like to refer to it is we essentially lose the patient experience. The voice of the patient, what they went through, becomes lost. And when I left practice mostly to come to Flatiron and patients asked me what I was doing, to me to them, the theme of trying to learn from the experience of those patients who don't go on clinical trials really resonated very much. So we actually thought electronic health records were going to solve this problem, right? We thought that it would help us learn about patients who weren't on clinical trials, would make it more efficient for patients to get on clinical trials. And I think everyone here knows that hasn't actually been the case. And there are a long laundry list of reasons for that. But part of the reason that electronic health records haven't done what we thought they would do is really a data problem. And we talk about big data, but at Flatiron, we actually look at it a little bit different. This is one of my favorite slides. Than big data. We look at the cancer data problem as being one of complicated data. It's not big data in the way people do, data analytics on, like Facebook does or, Twitter does, but it's really trying to figure out how do you make sense of all of the complicated data that comes out of the care of